since 2009. I came here as an intern, so I completed all of my postgraduate medical training here. Prior to that, I was at the University of Pennsylvania where I did my MD PhD training. When I was just finishing high school, I participated in a summer outreach program at Rockefeller University in New York that was sort of designed for people in the Westinghouse Talent Search, which is who was running it at the time. And I did some work in a neuroscience lab, and I thought it was very exciting, but there was something that didn't quite click for me. And then the following year, I was able to get a position in a cancer research lab. And it was really this very clear sense of purpose and the value of the work that drew me. And honestly, I've just been following that line ever since. There's so many different ways to get at that. I mean, I think scientifically, it just has to do with how my mind works and how I like taking things apart. You know, I sort of think about dynamic processes and how they interface, where it's sort of multiple signals pulling against each other and how they guide the behavior of a cell and that sort of thing. I think probably the exciting part in terms of application and the things that are most relevant to the work that we're doing in fibrolamellar is, I think we're sort of riding this wave in oncology right now, or maybe at the crest of a wave of genetic medicine, where we've seen all of these targets come up, and there have been these amazing successes with a couple of them where we now have these targeted therapies that are able to totally reverse the course of a cancer. But what has always stuck out to me is that even with all of those successes, there are actually a lot of those targets which haven't been successfully gone after, that we haven't been able to turn into treatments in the way that we have with the sort of initial landmarks. And certainly that's the case in fibrolamellar. And what's exciting for me is coming back and looking at the question in a different way. So it used to be, take a tumor, find a target, make a drug. And that took us a really long way, and that had a huge impact. But now we take a tumor, we find a target, and it's not good enough. And it's taking that next step and going back over the ground with it in a different way, using the kind of strategies that we use, that I think is sort of the excitement and fun. Probably the most important one, which has sort of played a surprisingly large role in many of my professional choices, is that, for lack of a better way to say it, it comes out of a sense of justice. It's always bothered me that there are these huge disparities in how much focus and investigation different cancers get, and that there's some cancers where, you know, there's huge awareness and there's a huge amount of engagement at the societal level. And there's some cancers where, you know, maybe because of the population they affect, maybe because of the symptoms that people with those cancers have, that sort of don't capture the attention of the greater society. And it always seemed to me that as a physician and as someone who is trying to advocate for the health of everyone, I should find the places where there's a need. And that's really what drew me to liver cancer in particular in the first place. And now I'm talking more about the adult liver cancers, but working in this clinical area and seeing the population of people with liver cancers, I came to encounter patients with fibrolamellar. And fibrolamellar is a tumor which is even more unjust. The idea that someone in their teens and 20s is facing the same kind of thing that people who have, you know, who are still being caught too early, but have had the chance to live their lives and, you know, come to the place where they're actually stable and ready to take on that kind of challenge, as opposed to people who are just coming into themselves. It seems like, it just seems very important that people should engage with that and should try to do something about that. And I think from a scientific perspective, you know, you need to find the problems that engage you, and you need to find the problems that you're equipped to solve, right? Because you can care plenty about something, but if you don't know how to fix it, you know, that didn't get you that far. And it so happens that the kind of work that we do and the training that I've had has positioned me to be in a good spot to take on some of the core questions in fibrolamellar, which I at least think of as a kinase-driven malignancy. So I think it's the combination of justice and the lack of and the presence of a skill set that suits itself to the questions. Research focuses on the signaling that's activated by the PKA fusion. So when we think about cancers and how we can stop them from growing, we look at what's making them grow in the first place. These are the oncogenes that drive cancer growth. Based on genetic work supported by the Fibrolamellar Cancer Foundation, when I was just starting to learn about this tumor, it's clear that there is a single dominant genetic event that underlies the majority of this disease, which is the formation of a fusion between PKA and the DNA JB1 chaperone. Unfortunately, this is not something that, at least right now, we're able to target directly. And so it seems like the key question in the short term to understand the character of this disease and to move rapidly to develop treatments for this disease is to figure out what that oncogenic fusion does. And so our work has used proteomic analysis, which is a sort of global approach that you can use to understand the behavior of proteins in the cell, specifically signaling proteins like the PKA fusion, to find out what happens when that fusion is present, when it's active, and when it's inactive. And based on that, we can then guess what might be an important target in those cells, what might be driving the behavior of those cells, and look for drugs that are already available to interrupt those processes. I want to be cautious not to oversell a specific thing, because honestly, there's, the history of oncology research is littered with promises that aren't able to be delivered. I think there is a lot of promise. There are a lot of things that I'm very hopeful about. Some of it's my own work. Some of it is the work of other people in this field that I'm aware of. I think that there are good things coming, but I think to say, I know which one it is, I think would be a mistake, and it would lead to I think it would have a negative impact. But I will say, between what we're doing and a number of other investigators that I know, I think we will see substantial steps in the short term, and hopefully we'll be positioned to have a very meaningful effect on the disease in the long term. Collaboration is essential. I think it's not just important, but I think it's obligatory. The current state of research, of biomedical research, is that there are a lot of very specialized investigators out there. I'm one of them. The techniques are complex, the questions are very specific, and you can't do it all. Particularly for the study of a cancer like fibrolamellar, where we started from zero probably about 8 years ago. You can't have one investigator working alone fix all the problems. Everyone's got to bring their best, and everyone's got to work together so that the things that I can do, I can contribute, and the things that others can do that I can't do, they can contribute, and working together we can actually make the substantial progress that would be substantially delayed if they had to wait for me to finish before they could do their part, and vice versa. The biggest challenges of finding a cure for fibrolamellar are the biggest challenges that we face throughout cancer, which are that these are hard diseases to cure. I think the reality for most oncologists right now is that cure is an exciting idea, but we're still in the business of trying to prolong people's lives. That's valuable, that's important, that's what I get up every day in the morning to do. But I think that to actually talk about cure requires a better understanding, not just of an individual cancer, but actually how the body handles cancers. Over the last 3 or 4 years of my practice, I've started to see advanced solid tumors be cured. Right now, it's not a situation where there is an advanced solid tumor that can reliably be cured. But we are now starting to see patients who, because of a succession of fortunate responses to treatment, will sometimes actually be cured of an advanced cancer. These right now are outliers. Understanding why that happens and how we can make that generally accessible is the next great work of oncology. But at least to me, other than to say we're going to need to harness the immune system and we're going to need to stop the tumors from growing, I don't know what that path is yet. But I think that there is a lot of work that we can do in the meantime to reduce the suffering that are caused by these diseases, and in doing so, discover what the actual path is to a cure. I honestly think the Fibrolamellar Cancer Foundation is pretty much doing everything right. And I think that its track record over the last couple of years really shows it. Its willingness to support work innovatively, it's the efforts that it's made to raise the profile of the disease, these have a huge impact. I think the challenge is that there are no clear models to accelerate research beyond what the foundation has already done. Supplying the funding, creating the scientific environment where collaborators work, or where colleagues can meet and where there's engagement and excitement. I think that really what's happening right now is the building of momentum, and with more momentum will come more involvement. So I think honestly, the challenge is less about bringing in more people, and it's more about expanding the scope of the questions that need to be answered, because as there are more questions, there will be more people who are specifically suited to answering them. So I think right now the best path to get more people involved is to keep making the progress, keep making the discoveries that will connect to new scientists who didn't realize they had an interest in the disease. Some very tangible things that the fibrolamellar patient community can do to accelerate the road to the cure. But I think before that, every individual patient needs to remember to take care of herself or himself. Being a person with cancer, no matter how young or old you are, is incredibly challenging. It drains your energy. It can be very frustrating. And I think that always remembering to put yourself first and give yourself what you need as the patient, as the person who has the cancer, is essential. That said, there are some specific things that have been done and can be done to help people on the research side. And I think the most valuable one so far has been participating in biobanking efforts. One of the things that has really held us back in this cancer is not understanding the disease, because we don't have good models of it. We don't have tumor cells that we can grow in the lab and study. And the contribution of patients of their tissue has actually allowed us to develop these models and start to understand this cancer and use the kind of screening technologies that can help us find targets. I do think that the role for advocacy is also very important. Just making sure that people know what you want and making sure that you're talking to the people who have the power to bring it to you. And that's something that you need to do in your own care, and it's something that you can do to advance the field as a whole. So I'm a parent of two small children. They're still 7 and 1. And I can't imagine how I would handle it if either of them faced a life-altering diagnosis. Whenever you see something coming at your family, or in particular at your child, I think the inclination is to put yourself in the way, and whatever is going to hit them, try to take it on yourself. And this is something I see in the parents of a lot of patients with fibrolamellar. And I think that the advice that I would give to these people, and this is just the advice I give to cancer patients and their families, it's not something that I have experienced in my own life, is to remember that it's a marathon and not a sprint. And that your family member is going to need you today, they're going to need you tomorrow, and they're going to need you going forward. And so to remember to also take care of yourself, and to remember that you need to hear them, you need to know what they need, you need to know when they need to do it for themselves, which is impossible because usually no one knows anyway. But remembering that this is something that it is affecting your loved one, but it is affecting your whole family. and being sure to balance what is needed today with what will be needed later is essential, but also incredibly hard. Academic scientists can pull up their resume and say, "Oh, well, I'm proud of this one and that thing." But no, I think probably the thing that I value most is that as a scientist, not only do I get to do the work that I'm doing, but I get to see the people that I work with put themselves into what they do and see them do things that I can't. I don't know that that's actually a message of interest or importance to this group, but I think the thing that's most exciting to me about what I do is seeing other people do things to answer questions that I care about, that I can't do myself, but I helped make possible for them. Like, that's the cool part. That's the thing that's the most fun.